Hello, ladies and gentlemen. Welcome to tonight's show. Well, it's not really a show, it's a conversation between women. And this young lady here, I am so proud of her. She is inspiration, inspiration to me, inspiration to my family, to know that we can do anything we want to do. It's work, but we can do it. And not gonna take any longer. I'm gonna introduce her, Sade. Yay!
Hi, thank you for having me on. Um, so let me just start by saying I'm grateful to be here. I'm so proud of you for even having this platform to have these conversations with other women and to bring different topics to light. I am so excited for you and what you have coming down the line. So thank you for allowing me to share in this space with you.
Ooh,
Um,
thank you so much. I love it. I love it. I love it.
um, So let's see, I'll tell you a little bit about myself first, okay?
Yes, yes.
I am a registered respiratory therapist at Connecticut Children's Medical Center here in Hartford. I've been working there for about 4 or 5 years. I can't remember the
Yes.
exact date, but about 4 or 5 years now, and I love it. I do respiratory and I work in the sleep department there as well.
Yes. So tell us, when did you decide you wanted to do respiratory? Because you know something, when you told me when you graduated, I just said, okay, what's that? It sounds important, but I've never heard of it before. And I just like, okay, I'm here for the graduation. Let's not worry about what it actually entail. She's graduating, she went through school. Let me applaud and show up. And you tell me about your job, and I'm trying to say, I never heard of this before. What is this? And lo and behold, COVID-19 came about.
And then, surprise, you hear about us everywhere, right?
Every day, all year. And 2020 is COVID. I'm still hearing about it.
Yeah. I decided that I wanted to be a respiratory therapist quite some years ago. Actually, how it happened initially, I was torn between respiratory and nursing. But
Mhm.
what really made me pick respiratory, well, let me take it back and tell you how I wanted to go into healthcare. When AJ, my son, was 2, he
Mhm.
had his tonsils and his adenoids taken out, right? And he almost died from that surgery. So we were in ICU at Yale, and I was a young mom. I had him at 20, right? So I was very young. And so the way we were treated, I just I was distraught. Here I am in this room thinking my child is going to die.
Mhm.
I'm terrified. I'm alone with him. My parents weren't there. His dad wasn't there. It was just me. And so the nursing staff and the respiratory therapists that were coming in to see him, I'm just kind of like, they were brushing me off a little bit. And I could tell it's because they assumed I was a young mother. I didn't know anything, right? When I left there, I felt like I never wanted anybody else to feel that way. I was so hurt because here I am trusting you with my child's life and you're treating me like crap. First of all, that should have never been the case. Patient first, but when you treat a patient, you treat their family too. You do not allow anyone to feel that way. So I was very upset when I left. And I told myself then, you know what? I want to do this because somebody needs to step up and say something. I don't want anybody to feel that way. Obviously I can't change everything, but I felt like if I went into this career field and I was able to help people when they're at their lowest points,
Mhm.
it would make a difference, right? Because you're already sick. And we're seeing some of these patients that are bankrupt, just financially, mentally, physically, they have nothing left. And when you come in and you treat them like they're not humans,
Yeah.
that's awful. So that's how I decided I wanted to go into some form of healthcare. I wasn't sure if I wanted to do nursing, respiratory, I really didn't know. So I went to school and got my first degree just in healthcare in general. And I'm
Yeah.
like, this is not working out. I want to do something a little more. I don't want to just be on the administrative side of things. I
Mhm.
want to kind of be hands on. So I went back to school
Mhm.
and I started in a nursing program, but then I met a gentleman named Mike Murphy, and he was in charge of the respiratory program at the school that I went to. And so he was the clinical director.
Mhm.
And I listened to him, and he was showing me different things. And I'm like, that's what I want to do. So ultimately, I decided I wanted to do respiratory because it's a specialty and it
Mhm.
allows me to really spend more time with my patient for special reasons.
Mhm.
Nursing is amazing, right? But with nursing, you're kind of focused on everything. You have to do so many different things. With respiratory, you go through the same exact schooling that you go through for nursing, but in addition to that, you have respiratory specific classes.
Mhm.
And so it allows you to really just um, focus on your specialty.
Mhm.
So I go see each patient. I'm not with my patients as long as the nurse is, but I'm really with them, not just doing everything. I'm focusing on their breathing and so many different things that may be going on at that time. So it allows me to be more intimate with the patient, so to speak,
Yes.
um, and just really handle them in a different light.
Wow. It's important because I didn't realize when you talk about respiratory, when it comes to surgery, they're everywhere. You are in every aspect as a nurse and a person that put them to sleep, the anesthesists. You're like an anesthesia specialty. You come in the room, people make way for you, you do your thing, and then if a crisis happen, they call you, they step aside, you come in, you do your thing. So I
Mhm,
understand that, and all this time, I've been to the hospital in and out for family member, and I've seen someone like you come in a room, but I just lumped you with everyone else because I didn't know the difference
mhm.
between. And I
And
didn't.
that happens often. A lot of people do that because a respiratory is kind of a new field. It's kind of a new career field, right? And you said something important. Up until COVID, people really didn't know what we did, right? Prior to COVID, I would say, "Oh, I'm a respiratory therapist," and they say, "Oh, you do breathing treatments." Well, yes, a small portion of what I do is breathing treatments. We do that, absolutely. But you have to do so many other things. So, like you said, for example, if a trauma comes into the emergency department and
Mhm.
that person is not breathing, well, guess what? I'm there.
Yeah.
Anytime a trauma comes, we are there. We are at the head of the bed, making sure our patient can breathe. If you cannot breathe, you cannot do anything else, right?
Yes.
So, you hear people say all the time, oh, a family member is on life support, right? Well, we respiratory therapists are those people that put those life support, those ventilators in place. We tell the ventilator exactly what type of breath to give you, how much pressure, how often you should be breathing. And then when you are taken off of the ventilator, we do that as well. Anyone that has a neuromuscular disease or any type of brain injuries, people that have kidney failure, all different types of things would become one of my patients, right? Because what people don't realize is your body works in a certain way and your organs work together. So your brain, for example, if you have a brain injury, your brain might not trigger your body to breathe correctly. So I
Mhm.
need to be able to step in and do that for you. So it's a lot more in depth than just breathing treatments, but yes, we do do a lot of breathing treatments.
Yes. Like I'm saying, I saw people like you, and I never thought about just kind of clump y'all with the nurse. And
Mhm.
I know you're doing your thing. Okay, that nurse is doing that. And I knew she was doing something specific, but I never knew there was a title associated with it. And
Yeah.
so glad, everything happened for a reason. Now it gave people a sense of awareness to acknowledge respiratory therapy. And I do believe the field have went up a
It
lot.
definitely has. And I think I'm not thankful for COVID because it's been a
Oh,
terrible disease, but I am thankful that it kind of did bring light to our career because now it opens up the doors for other people who didn't know about it before to explore this career option. It's very rewarding. It is an amazing career. However, it's very stressful, so you have to be aware of that. A lot of the times you bring that stuff home. So you have to have conversations with your family to let them know, just as you do with nursing, this is what I'm going to do and this is what it entails. Because some days you're going to have hard days at work. Some days people aren't going to make it. And then on other days, people do make it. So it's very rewarding when you can go in and you can help someone and make a difference in their life, you know. So I'm excited that COVID did shine light on the career.
Mhm.
Um, and people are aware of who we are and what we do. You know, people have heard of us before. Like anytime you're in the ICU or somewhere, if you listen, you can hear someone always yelling, respiratory, call respiratory,
Yes.
because we come in like superheroes. We swoop in, we save the day, and then we're out of there.
I like that. So during your journey,
Mhm.
how was it? Was the journey in school difficult or was it just a smooth sailing?
I'm gonna be honest with you. I love what I do with all of my heart. But if I had to do it again, I wouldn't do it. And the reason I say that is because it really is a career where if you can go to college for 4 years without working, that's
Mhm,
your best option
mhm.
because it is draining. It
Oh,
is very, very draining and it's scary and stressful. You're exposed to a lot of things that you had never seen before.
mhm,
You know, when I was going through school, I was working full time. I had a family, you know, I had my husband, my
mhm,
son, my stepdaughters. So I had all of these people still relying on me. So I still had to work full time. I was going to school full time. And that means classes 5 days a week or 4 days a week, and clinical 2 to 3 days a week. And when you do clinical, you're doing a 12-hour shift. So there were many days when I did not sleep at all. You know, I had clinicals primarily on Tuesdays and Thursdays.
mhm.
So I would go to work. I would get to work for 7 in the morning. I would leave work early to be to clinical for 3, and then we'll go through my clinical shift and do it all over again the next day. And I did go to school at night. So on the days when I didn't have clinical, when I got out of work, I went straight to school and I was at school from 5 to 10:30 at night. And for a very long time, for years, you know, and so you have to find a balance. You have to really have support. Without support, you won't make it. You definitely, definitely need the support because there are times when there's no way I could cook dinner, go to school, go to work, you know, try to take care of everything else. And then the weekend comes and you have children, your kids want to see you, they want to do things with you on the weekend. And you have to study and do papers and homework and stuff. So it was very challenging, worth it. It
Yes.
was worth it. I wouldn't change my path at all because I definitely feel like it taught me to appreciate where I am today in life,
Yes.
but it was a very difficult time in my life.
Yes, I hear you. I understand it. And I took similar path. I took similar
Mhm.
path, worked full time and went to school full time. And the kids, you just like you said, support system is very important. And people need to remember the saying, it takes a village to
Yes.
raise a child, and your village is your support system. And it doesn't necessarily mean all family, it's friends, family, and whoever you feel trust in your circle that believe in you and want you to
Mhm.
succeed. Those people are your village. Those people will pick up and you can assign duties to them. So everyone out there, remember that nothing is too difficult to do, but you just have to surround yourself with the right people.
Absolutely.
The
And
right.
especially when you're going through something like this, you have to surround yourself with people that you want to see or that want to see you do well. Because
Yes.
if you have the wrong person in your cycle, it's very easy for someone to sabotage you going through this process. And you won't
Toxicity.
even see it because you're so overwhelmed by everything
Yes.
else that
Mhm.
you won't even notice it. So you have to be very selective of who you have in your life. And especially when you are trying to better yourself,
Yes.
you know, everyone says, "Oh, I want you to do better," but when you're actually trying and you're doing better, sometimes people can be a little
Toxic.
judgmental and, you know,
Toxic.
try to coach. Yeah, a little toxic. So you want to just be mindful of that because in this process, regardless of whatever anyone decides to do or go to college for, right? In that process, you have to be focused and you have to be there for the right reasons. So you have to try to keep your stress level down at home as much as possible because school is going to stress you out. College is not fun.
No,
It
it's
is
not.
not a cakewalk. You know, maybe when you're 19 or 20 and you don't have a family, but nowadays that's kind of unheard of. It's different now,
Yes,
people are going back to school at older ages, or families are starting at younger ages. So you just have to really be mindful of those you surround yourself with.
I agree with you 100%. Toxicity and people who are jealous, they want you to succeed verbally, but
Mhm.
as far as you going past them, they don't want you to
That's
succeed past them. You can do well
exactly.
as long as you're not doing better than them, and they'll cheer you on. But we all know that happens. So once again, you made a good statement. Monitor the people
Mhm.
and think about, feel them out, hear them out, and spend the time to get to know your friends. And
Yeah,
just friends, family, because jealousy does not just stem from friends, it stems from family members as well.
absolutely. And one important thing that I know now that I didn't know going through this process, is that it's okay to say no. It is
Yes.
absolutely okay to say no sometimes. You can't do everything. And I'm still learning that even now that I'm well removed from college, just in my personal life, it's okay to say no sometimes because those who aren't going through it don't understand what it takes to make it through whatever process you're dealing with. You do because you're there, you're directly going through it. So take that time and dedicate to schoolwork if you need to. You might miss a family function or a party or something, and that's okay because you're bettering your life. There'll be more of those to come. So you just need to stay focused. And if you feel overwhelmed, step back a little bit.
Hmm.
You know what I mean? Don't overload your plate.
Yes, I agree with that. And a lot of people feel obligated to say yes to people, and I always tell people, no is easy. You have to stop and think. You're saying no to yourself when you say no. If it's something that you have to do, and it depends.
Mhm.
There's two reasons to say no. You have other things that have to do that's important to you. And no, you just don't want to participate. Sometimes you don't have to have a read. You don't have to be busy somewhere else to say no to this. And a lot of
Right.
people associate that, they feel obligated. I don't have anything to do, but I don't want to go. Then just say no, because
Right.
when you're honest and transparent, the person who's inviting you, if they're true people, no, not fake, they'll understand, because they don't, all they know is that they want you to come to this thing, but they don't know how many other things you're invited to, and they don't know how many other things you're participating in. They don't know your plate. So far as they know, and if they're really, really not selfish individual, you can say, listen here, I can't, because I'm just tired. I need this time for myself. Boom, end the
Hmm.
conversation. There's always other times,
Yep.
other situation. And so when you think about yourself and your mental, emotional, spiritual, physical state of mind, if saying yes mean that it's gonna drain and make you weak and just bring you down, then you need to say,
You need to say no.
yes,
Absolutely.
that could be your one day of rest you have. Your one day of rest. And if you feel it's gonna take its toll on you to participate, it's okay to say, listener, I can't. Next
Yeah.
time, let me know further and more in advance, and I'll be able to, but I can't today. I can't.
Hmm.
Oh,
And honestly, a true friend or a true loved one
yeah.
wouldn't want you to put yourself in a situation where you're draining yourself even more. We're all adults, we understand.
Yes.
Sometimes we just need that time. Your body needs to reset because it
Mhm.
doesn't. If you don't allow your body that time, you're no good to anyone, right? So if you have a family that you're taking care of and your body starts to shut down because you haven't allowed it the proper time to rest, now you're impacting the other people in your home that you're looking after. So it's important for yourself and for your family that you take some time to just kind of rest.
Yes, I agree with you. And so we have to keep that in mind. I'm so glad you brought that up, because so many people out there are tied to the word yes. And the people who are asking them constantly know that they won't say no.
Hmm.
And as long as what they're asking is going to benefit them, they're going to continue to ask. I also tell people, remember, as you're asking people, remember you're going to be asked to. So put yourself in the position. You know what I mean? And
This
so
is
don't
true.
get mad. Don't say, when you say no to someone, you don't want them to get mad at you, then respect that person no when they say no to you, because everything goes around. There's going to be a situation where
Yeah.
you're going to have to say no yourself. So respect that person no. I'm so glad, because I think that's something that people need to know. So once you're in your career,
Hmm.
how was the process? Has it been a difficult journey? No name mentioned, just, just no name. Listen, you got a job, do a
Um,
job.
Difficult. I don't know that I want to say, I'm going to say challenging, right? I'm not going to use
Yes,
the
I
word
love that
difficult.
word.
I'm going to use the word challenging because difficult sounds a little more negative, right? But
Yes,
challenging. And
yes.
the reason that for me, and again, everyone is different, so what might be a challenge for me may not be for some others. But for me, my career has been a little challenging to start. I
Mhm,
work primarily with children. I do work with adults as well, but I work primarily with children.
mhm,
So it's a different, you have to be a different type of person to be able to work with kids, right? Because sometimes, with adults, sometimes you see them
mhm.
and whatever ailments or whatever's happening with them, it's primarily a lot of the times they've done it to themselves, right? And that's terrible to say, but it's the truth of the matter. For example, if someone has COPD and they're a cigarette smoker for 50 years,
Mhm.
well, chances are your COPD is because you smoked cigarettes for 50
Yeah.
years. But when you have a brand new baby, freshly born, that
Mhm.
has, a heart condition or a brain injury or so many other things going on, it's different. That, that's not that baby's fault. It's not the mom's fault. It's not the parents' fault. You just have to view it in a different light. And so you have these innocent babies that you're working with that are sick. And it's hard to see parents going through that. It's a lot of crying. It's a lot of, um, especially with mothers, kind of that self-blame. Oh, well, I didn't do this right during my pregnancy, or maybe if I did that, and them not understanding sometimes things just happen. So it can take a toll on you emotionally. It took me a while to really get that
Yeah.
because I love kids. So I'm like, oh my gosh, all these sick babies. And I see really sick babies because Connecticut Children's is the only standalone children's hospital in the state. So when children go to other hospitals and they can't fix them, they send them to us, right? So we're a level one trauma. So we get the sickest of the sick. And so it took me a while to really adjust to that, especially after college, because you don't work with kids in college. Everything is based off of adults in the adult world. So
Mhm.
when you start working at a place like CCMC, you have to really train yourself to work with kids because everything happens differently with these little humans. Um, the modalities or the methods that we use to deliver treatments to adults is not exactly the same as children. It might be the same type of equipment, but you have to use it in a different way just because their lung capacity is not that of an adult. So, you have to treat them a little bit different. And so that was very challenging. And then somebody's life is in my hands at this point. I'm no longer in school. I don't have someone there with me
Mhm.
by my side 24 hours a day telling me what to do. I'm on my own now. So it's very scary when you start, and you have to really trust your training. I know people have heard this before when it comes to different things, but trust your training. You have to build confidence. And so when I first started, I was afraid to do certain things because I'm like, oh no, I don't want to hurt anyone, or oh no, what if I don't do it right? But one night, I'm going to tell you a quick story. One night, I was at work and I was with another respiratory therapist who was supposed to be my resource.
Mhm.
I'm working in the ICU or the PICU, which is the ICU for pediatrics, right? So I'm working in the PICU. My resource disappears. I now have a child that is coding, and what that means is this child is trying to die.
Mhm.
What do I do? I'm terrified. I am ready to like sink back in the corner and cry, but I can't. So I have no choice. I go in this room. I'm nervous. The doctor knows I'm nervous. He can see my hand shaking. He's like, "You're okay." He stood right next to me and he talked to me the entire time. That night was life changing for me because I never wanted to feel that fear that I felt right then. I didn't want to feel that again because I didn't want that to get in the way of doing what I needed to do to save my patient. So after that, I started advocating for myself more. And if I didn't know how to do something, I spoke up and said, you know what, I don't know how to do that. Or if I needed additional training, I spoke up for myself and said, listen, I need to be trained on this again, or I don't, understand how to do it. Walk me through it. I started aligning myself that with people that I knew could help me in terms of okay, I'm going to put myself on the work schedule this day because certain people are working. I know in between, if we have any downtime, this person can teach me to do this because they're great at that. So, whatever it is I needed help with or I didn't understand, I would work with someone that was great in that area. And then I would move on to the next thing and work with someone that was great in that area. So, that's what I mean by challenging. You have to really find yourself and it takes a while. It doesn't happen for everyone at the same time,
Mm-hmm.
and it's scary. So it was very, very challenging. And still now, every day you walk into a room, you don't know what you're walking into, or a trauma comes in, you don't know what you're going to get in that trauma. So you always have those challenges, but you just have to really advocate for yourself and make sure that your knowledge is on par so that you're not afraid to do your job.
Woo! Thank you. You just said my motto: self advocate, self preservation. And I tell
Hmm.
people that all the time: self preservation, to will to live to survive. Because if you want to survive and you don't want that feeling again, then what do you got to do? You got to advocate to yourself so you don't get that situation again. So those two together is
Yeah.
survival tool. And I tell people all the time, you have to learn how to self advocate. And we do it so often and don't think about it because in every aspect of our life, we're advocating for ourselves. And I love what
Hmm.
you said. You align yourself with the right people for what you wanted to learn each time you came around. I love
Hmm.
that. Kudos. I love that.
It was hard to do, but I had to do it. And another thing that I kind of want to mention that it's kind of taboo, people don't talk about it or say too much, but for Black women in healthcare,
Yeah.
we are often not respected, right?
Yeah.
Because we're Black women. You
Mm-hmm.
have to speak up. And society over time has said, oh, Black women, they're loud, or no, we got to get over that. Speak up for yourself. This is your life, this is your career. If you don't know or you want to know more or something different, speak up for yourself because no one is just going to willingly come and give it to you.
Mm-hmm.
Go out there and get what is yours. Speak up because that's the only way you're going to get over whatever hump it is that you're at.
Thank you. I love that word because that's one thing that I've realized, and that's one reason I'm having this platform to give Black women an opportunity to speak and let other people out there know that there's career out there for you. It's not going to be easy, and this is the path I took because I'm telling you what you just said before that about you align yourself. You looked at the schedule and you aligned yourself with people who you know can help you. You can do that at any workplace.
Hmm.
You can align yourself with
Absolutely.
people who you know are willing to show you things and move you up. And also, we need to also help each other. A lot of times,
Yes.
people get ahead and they're scared to bring another person in the room because they feel they only want one, they only can know. They can have as many if they want. If both of y'all are good, they'll take both of y'all.
Hmm.
And you don't
Absolutely.
have to be, you don't have to close
Absolutely.
the door behind you. You leave it
Yeah.
open and bring the next person in. And the next thing you know, they'll have a room full of qualified young Black people in there. And when they have that, then their narrative have just changed because versus just 1 out of 20, yeah, we only got this one good person. No, but if you help the other, they'll say, wow, these young people or these individuals are very good. And that's what you change in the
Absolutely.
narrative by helping your brother and sisters in the room. You change the narrative of the people that's constantly keeping us out the room and locking the door. If you get
Hmm.
a foot in, crack it. But you have to be wise in who you bring in. Unfortunately, you do have to be wise.
And when you go through it, kick it down, kick the door all the way
Yeah.
down, okay? Because sometimes it has to be that way. Sometimes you just have to do those things, and I'm blessed because I had two, I'm gonna say their names, Ebony and Tanisha, who are
Mhm.
two Black women, respiratory therapists that were there long before me. And when I tell you though, they were my day ones, I was constantly on their back. Hey, what's this? How do I do that? Whatever. And they never judged me. They never made me feel stupid or like, oh, well, you should already know this because you went to college. Da 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 da. No, it was never any of that. So I'm blessed that I do have people that came before me that left
Mhm.
the door open for me to get through for sure.
And we have to remember that by they willing to help you, because it's a reflection on all of us. When we can come in
Hmm.
the room and help each other, and we all can sit at the table equally and speak about the situation intellectually and be able to look at each other for support. If I'm starting off a sentence, I'm not sure. Hopefully, you will look towards me and see that I'm not going to get it right, and you step in, and we just
Right.
blend with each other so it's seamless.
Absolutely.
And we have to remember that as women and as Black women, that we have to support, and as Black people, period.
Hmm.
We have to support each other when we're in a space and that person has the good intention, the right intention. Now we know there's not so nice people sometime in every race, and
Of course.
and that goes for all race, not just Black race, but all race
Hmm.
have not so nice people. And those are the people you just have to keep on the side of their toxicity. But I'm so
Absolutely.
excited. So tell me, what's your journey? Where do you see yourself going
Mhm.
from here in your career at the hospital? What level can you go up? Do you go across? What is it?
I haven't quite figured it out yet. Another part of my career that I haven't spoken about is my service in public health. I work in public health as well. So I for me, I feel like I want to always be a respiratory therapist for sure. I'm never going to walk away from
Mm.
this, but I definitely think I want to do something more in line with public health because our communities are suffering and I want to make a difference. I want to be able to bring great healthcare um, to our people, to our communities. And right now we're struggling with that. So I think that's really where I want to be, and making a difference along those lines.
Oh, I love that. I love that. It's nice
Mhm.
to give back. We all move forward and we never look back. So it's nice to be able to move forward and look to your left and right and back, and not mean that you're looking at your path, but you're looking for the people behind you to bring them forward with you as well in any capacity. It doesn't have to be job,
Absolutely.
but through public service. I agree
Mhm.
with you. I also volunteer, and it's important. It's enriching to volunteer and know that you can step into this place, and just you being there for whatever amount of time you're there, you're helping somebody, you're available to somebody who might need your help. And I think that's
Yeah.
important. I love
I
that.
I'm a firm believer in if you can help somebody, you should, right? And I am blessed to be in the position that I'm in. And I just feel like everyone has a gift, everyone has a lane, and this is mine. And so I want to definitely be able to bring awareness just to health in general and so many different things. Asthma runs in our community. Asthma is crazy, diabetes, so I definitely want to work with that local hospitals and local community organizations to figure out some sort of health line that we can bring to the community to fill in those pockets where we're lacking. There's some things that we have great in our communities, don't get me wrong, but health happens to be one of the issues that we're facing, lack of health resources. So I definitely want to kind of get my foot in the door there. And I feel like being a respiratory therapist is rewarding on so many levels, and it allows me to see so many different people and different challenges. I talk to a lot of people
Yeah.
with what I do, and so I soak all of that up and I listen to all of that. So by listening to my patients and seeing the things that they're directly dealing with, it's definitely pushed me into that direction. So yeah.
Okay, wow, that's wonderful. Thank you so much. Is there any advice you'd like to give to young people who are in college and just want to get out of high school and start college on their journey as a young woman who, graduated now, a family and everything? Tell me, what do you like to tell these young people?
Well, I've had this conversation with you plenty of times, and I'm not sure the right way to say it. So please guide me if I say something that may not be 100%,
Mhm,
appropriate. But first of all, college isn't for everyone, right? We always college, 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 college. But, it's not for everyone. And if it's not for you, that's okay, but you have to have a plan, right?
mhm,
You have to figure out what you're going to do. And maybe it is for you and it's just not right now. The thing is, you need to do it when you're ready. Because if you don't, if you're not ready, you're not going to absorb all of the things that you need to absorb while you're there. You're going to be paying for this degree that's essentially useless because you're not going to learn, right? So, my advice is regardless of whatever path anyone chooses, have a plan. Know exactly what it is that you want to do. Research it. Don't just jump into it because you heard, oh, I heard welding is a great career. I'm just going to go be a welder. And you have no idea what a welder is. You
mhm,
know what I mean? Research it. The best thing, honestly, that I felt was great for me, take a personality test,
mhm.
right? Because you might want to work with kids and you might hate working with kids when you get there because you don't like loud noise or you don't
Yes.
like mess. You know what I mean? So that's not the right career for you. Take a personality test. Believe it or not, there's a lot of information, a lot of insight you can take from that to kind of help you streamline these different careers that are out there and just research, talk to people, write down the things that you really, really like and enjoy. Because when you can find a career that embodies all of those things that you like and enjoy, you're not going to work every day. And I know people say that all the time. I don't get up and I'm like, oh my God, I'm so stressed out. I got to go to work. No, I get up and I'm like, I'm probably going to have a stressful day at work, but that's all right. I love what I do. You know what I mean? It's
Yes.
fun. I have so much joy in that. So when you look at things from that light, I think it will change perspectives on the paths that people take. So
Mhm.
definitely, definitely write down what you really like and try to find a career that embodies the majority of your list. You're not going to find everything on your list. Let's just be clear. You're not going to do that, but you can find a career that has a large number of the things that you enjoy. So that is important.
And balancing family. Now, the next question
Mhm.
I want to ask you, you have a family. What has that been like? You have talked about it a little bit, but
Mhm.
now that you're finished with school, because I'm sure it was a struggle then, now that you're finished with school and you're actually working and you're pretty good in your career, how is that now with the family?
It's
Balancing
great.
stuff.
Now my kids are older.
Yeah.
So, AJ is 17, Adria is 17, Madison is just turned 21. We have Kalani, who my niece, who is 4.
Mhm.
But she's here and there, so that's not really a big deal. But the older kids, they're able to take care of themselves. I work nights.
Yeah.
So when I go to work, they're just really kind of winding down at night, getting ready to chill out and go to bed soon. And when I come home in the morning, they're just leaving for school. They're
Mhm.
very understanding of what I do. They ask a lot of questions because they do see me sometimes when I come home and I'm stressed out, or if I've been at work and a patient unfortunately didn't make it, you take that home with you. You're human. You try not to, but you do take that home with you, and your children pick up on that. And so it's been a learning experience for all of us. They've been huge supports for me. Like, that is my support system. There have been days when I'm like, I don't know. I don't think I really want to do this anymore. And they remind me, well, look at what you sacrificed. Look
Mhm.
at the events you missed with us and the time we sacrificed with you for this,
Mhm.
So, and it's great for them to see me not giving up.
Good.
I want to lead by example and I want to show my kids that sometimes you have hard times at work, at home,
Mhm.
but you have to really figure out how to deal with that. You can't just run from everything, right? So you take these challenges and you work through it. So it's important that I'm very open with them about that. And so it's been great. They love that I'm a respiratory therapist. When people ask them, oh, what does your mom do? My mother is a registered respiratory therapist. That's exactly how they do it. My mother, so, and they're proud of me, and I know that. And so that's what pushes me every day to see how proud of me they are.
Oh my
And
God.
so
I
I
love
don't give
that.
up.
I love that because I think it's such a good example when you can have a parents in the house and they can be true to their kids and let them know this is the journey I took to this career. Let them
Mhm.
know. Then Misa, when it's their turn, they don't feel pressured because they know that you understand their thought process and what they're going through, and you live transparent. And so they see the obstacle and they know that if they come up in a situation like that, they can go to you because you've been through it. You understand where they're coming from. And I think that's so important. We don't realize our kids really observe us a lot.
They
They
do.
do what they see us doing, not what we say. We can say make a left, but if they see us making right, they're gonna make right. They're not gonna make that
Absolutely.
left that we're telling them. They're gonna observe and they're gonna monitor how we handle situation, and that will teach them how to handle situation. And we need to remember that our kids are sponge and they soak up our behavior, our action, our respond to things in life and how we deal with it. That's what we're teaching them, how to manage life.
Absolutely, absolutely. And I'm very open with my kids about when I first started college. This degree that I have now is not my first rodeo. This is my
Yeah.
second degree, but it took me a long time to get here. And I'm very open with them about that. They know when I went to college the first time, I wasn't ready. I
Mhm.
didn't take it serious. I was more interested in partying and hanging out with my friends. You know what I mean? Like I didn't care about class.
Mhm.
So they know those things. And they were here,
Mhm.
afterwards when I tried to take classes here and there, and they saw how hard it was for me to actually be able to take time away from them to go to school, to do different things, and how long it took, how stressful it was.
Mhm.
And so I don't hide anything from them because, like you said, I could tell them whatever I want. They're going to do what they see me doing.
Mhm.
So when I have an achievement, I
Mhm.
share that with them.
Yes.
I engulf them in every aspect of that. And when I have a failure, I share that with them too, so that they can see, you know what? Sometimes you don't fail, but you don't succeed, but you have to get up and
Mhm.
start all over again. You can't fail and just wallow in it. You get one day. That's the rule around here. When something doesn't go right, you get one day.
Mhm.
After that day, we're moving on.
Good. Good. I
That's
like
our
that.
lesson. You have that one day to kind of woosah, bring yourself together, mope, whatever it is you need to do to get
Wallow
you
in it. Wallow in your sorrow
right.
for that day because
One
tomorrow
day.
ain't no wallowing.
Exactly. Tomorrow we're going to get up and we're going to put our boots on and act like, you know what? We're successful.
Yes, because I always feel when you have a plan, you need a plan A and a B. And a lot of people say one plan because if you plan to be successful, if you got to think, no, you got to have a backup plan and not a backup plan they can rely on. And these things depend on what you're doing. When you go
Mhm.
into college or career, you have to know, okay, I want this position here. And why do you want the position? And when the position comes up, you go for it. Okay, they choose somebody over me. You have to stop and think, is this person really more qualified or is it just politics? If it's politics, you realize that the people in that circle is not for you. So then you might have to go sideways then to go up another way. You have to go across because you realize these people are into politics here and they're not going to choose you based on your skill. They're going to choose their friends. So you go across, it might not be upward, but it's a lateral. And then you get over in this corner. Okay, these people are really based on skill.
Mhm.
And then you go up there. And those are the plans. You got to navigate, you got to know your audience, you got to know what you want and what you're willing to do. And
But you said
like that.
something very important there. If you go for it and it doesn't work,
Yeah.
excuse me, you might have to go to the side.
Mhm.
That's so important. I'm a firm believer in everything happens for a reason,
Yes.
right? If I don't get a position that I apply for, I don't, oh, I wonder why. No, it wasn't meant for me to have that position. I don't know why,
Mhm.
but for me,
Mhm.
everyone has their own beliefs, but for me, I feel like that was God stopping me from going and getting that position. It wasn't for me. You never know what could have happened there. Sometimes you can get in positions and it just changes your complete outlook on your career. Now you're so disgusted with it and you don't want to do it anymore. But that's your gift. That's what you should be doing, right? So sometimes roadblocks are put there for a reason. You don't always know it right away. Sometimes you may never know it,
Mhm.
but it's important to just not let that, internalize that. Don't internalize it. Take that and move on the path, get around it. Just keep your eye on your goal, right? It's never going to be a straight path to get to where you want to go.
I
It's
agree with
okay if you have to go, take a little curve here and there, take a left, take a right. That's okay. As long as you stay focused on what it is that you want to do, you'll get there.
Yes, I agree with you. I had the same thing happen earlier in my career. There was this position I wanted. It came up spontaneously because the person who had it had to leave suddenly.
Hmm.
There were three people. I've been in the position, my position, longer than this other person, but they had a more credential than I had. But I applied for it anyway. I wasn't ready to apply, but I said the position open, so I'm going to apply for it. So I applied.
Hmm.
That person got it, and I, congratulate her and stuff. Within 2 years, that person had to leave and run. They mistreat that person so bad. They abuse. I said, God, thank you. You are on my side.
Hmm.
They
See?
abuse the treatment, and I know this person is older than me, so they had more life experience and they had more
Hmm.
credentials. So if they got the job, that person knew their shit. Very smart. But the abuse that person got in that position, the just the oh my God, it was disgusting how they treat her. And eventually she left, and a man came in, no sense, no brains, but he was a male, and he got
Yeah.
kudos and a lot of assistance. There was another job I applied for. Once again, the person who had that position was retired, and they said, "Okay, you're qualified for the job." What they did, people above, they wouldn't post the job until that person leave, so that person would have an input in the hiring.
Wow.
When they put her position up,
See?
then they changed the title, they downgrade her position and they changed it around and opened another level because and made the level she had higher because they had somebody in mind for it, a friend,
Already.
friend. But then the middle position, I said, okay, I'll still take that one. They hired, I applied for the job, never got it. And we went to a meeting and I saw this young lady sitting there, same color as me. And I went over because somebody new in this meeting. Like,
Hmm.
hi, how are you? And then she said, oh, I got the so and so position. I'm like, oh, that's the position I applied for. That's how I knew the position was filled. Very rude, and they don't tell you. But the thing about it, after 3 years, this person left. This person came in around 2017, 2018.
Hmm.
2020, they left. They realized a year to 2 years in the position that they weren't going anywhere because there was a lot of politics going on. They went
Behind
and got
it.
their
Yeah.
masters and they left. So two positions that I applied for and women got it. And one of them wasn't a woman of color, but
Hmm.
they wanted a male in that job. And the other one was another woman of color. And after 2 years, she realized this place was just good. She left. And I'm saying, wow, I got saved twice, two positions.
Twice. Twice.
Twice. It
Yep.
wasn't
And
meant
you
for me
never
for
know the
forever.
reasons.
And
So you
wow.
just gotta trust the process, go
Yes.
through the path, and yeah, I'm glad that you didn't get those positions
So am
because
I. So am I. Because I'm very reluctant. I don't apply for, I know people apply for hundreds of jobs over the years. I'm very selective because I think about, when I look at the position, I think about where it's located because to me it's important. The hour, I look at everything. I just don't look at the
Mhm.
money. A lot of people will suggest to me, apply for this because it's making so money. No,
You can't,
money is
yeah.
not, no. I need to look at the entire job, the environment, and everything, and see, does it really work for me? Do I see myself in that space? Do I want to be in that space?
Hmm.
And because I want to be in a position where I can do the things I enjoy doing, and still, and make work enjoyable, fun, place I want to come.
Right.
And money is all good and well, but no, what I mean, I'm sorry, I'm just not that. Money's important now. Don't get me wrong, but
Money is important, but it's not everything, especially if you're in the healthcare. I work 12-hour shifts, right? 12 and a half hour shifts.
yeah,
I'm spending 12 and a half hours of my day
yes,
with certain people. If I don't like being there and I'm stressed out, I don't care how much money I'm making.
I ain't
I
gonna hold
can't function like that because the job itself is already stressful. So when you have people that you don't like working there or you're
you.
not happy with whatever, it's going
Yeah,
to be a long day.
yeah, it's
So
very
money
long.
is not everything. You make a great point with that, and I think a lot of people think, oh, they're going to pay me 100 grand.
Yeah.
Uh-huh. They may pay you 100 grand, but what is coming along with that?
Yes. What do you
You know
have
what
to
I'm
do for
saying?
that 100 grand? Because I feel a lot of time with certain position, they'll post it, and if they give it to certain people, they'll tag more responsibility than if somebody else had it. I've
Mhm.
seen where people had a job and they were complaining that it's too much work, and once they leave, they split the job in two.
Yeah, because it was too much work for one person. It
But
was a two-person job.
and they were willing to work that person along that person was willing to work it.
Mhm.
And you can complain all you want. And when they did
Yep.
it, both parties that they split the job and gave it to that they had in mind
Mhm.
get equal salary that that person had, even more.
A job is, here's the thing, as much as I love my career, at the end of the day, this hospital is a business.
Yes.
And it's not my business,
Mhm,
right? I don't own it. So I work there. And a
mhm.
lot of people, I think, get wrapped up in that and they try to go above and beyond all of the time. You should go above and beyond within your means.
Yes.
But sometimes when you do it too much, these companies realize, oh, okay, well, you could do that. Now that's a part of your job, and it wasn't a part of your job
Yes.
before, but now it is, right?
And you can
So
add
they're
it
going to
on.
take and take and take and take because it's their business, right?
Yes.
That's what they're there for. You're replaceable. We all are.
Yes.
So it's important when you have to realize those things because like you said, that one job, that person was saying it's too much work and then they split it in two. Well, they knew it was a two-person job all along, but they also knew they could get someone to come in there and do that job.
Yeah.
That one person could
Yeah.
come in and do that job. So you don't have to, when you start working somewhere, even before you start working somewhere, you can do research on the company that you are applying for. Read reviews, go on LinkedIn, look at what people are saying about the position you're applying for or the company you're applying to work with because you can find a lot of information. If there is a position, right, or a company and people, it's a revolving door, it's high overturn, there's
Yes.
a reason for that.
Hmm.
So you need to think about those things. I'm not saying don't apply for the job. I'm just saying take all of those things into consideration when you are applying if you have a place that has high overturn because people are leaving for a reason.
Yes. And they can't
You
keep
know.
people, and people need to stop and think about that. And
Mhm.
there's a lot of jobs that's open, but people will have to learn because some people think about the money first, and they have to learn. They'll get in, and sometimes those people get in, and if they're the right people and they get into the right clique, they can be saved. So
Absolutely.
yeah,
Absolutely.
yeah,
You have to, regardless of what situation you're in, always look for the positives, right? Everything is a lesson. So if you're in a situation, for example, and you do something to me, I'm not, I might get upset, but it's a lesson. I've learned what not to do or how to handle myself. You know what I mean? Literally every single thing is a lesson. It's just all about mindset. So you have to really train yourself to think like that and to look for those small things. But I think it's possible. And I think when people start doing that more, we'll be happier because we're not allowing others to have control over our feelings.
yes, definitely. Definitely. So thank you so much. Thank you so much, Shada. It's been a
Thank
pleasure talking to
you.
you, ladies, and gentlemen. I'm so happy to bring this young lady to you for her to tell you her growth in her career and her growth in life. It's very important for us to see role model to know that there's so many things out there that we can do, and it just take work and plan. And you just have to believe in yourself. You have to know you can do it. You can follow me on YouTube. As you can see, my company name is Self Survivor Empower Life Coach Financial. I'm also on Facebook under the same name, Survivor Empower Life Coach Financial. My business is Survivor Empower Life Coach Financial.com. I'm a certified life coach. I'm an accountant as well, but I'm here to help survivors in any capacity. The word survivor is such a unique word. You could be a survivor from a marriage, survivor from a traumatic relationship. You could survive when you have been through something rough and you made it to the end. What do you say to yourself? I survived. So
Yeah.
that word survive means so many things to so many people, depends on where you are in your life. But come to my website, see what I'm all about. I'm definitely here to help people move forward in their life. If you want to go from point A to point B, I'm here to assist you. I don't tell you what to do. I help you dig deep and pull out that star, that light, and help you to make it shine really bright. And so follow me also on Instagram. I'm under Self Transition Coach. So you'll find me out there. So it's been a pleasure, everyone. Have a nice night.
Thank you so much. Good night, everyone.